Hello everyone, it's your beautiful host Cindy Official and welcome to the Cindy Show. Today we are going to have an informative and an engaging program with you. Are you familiar with PCOS? PCOS is a common hormonal condition that affects women in their reproductive ages. Specifically, it begins with adolescence, but with time the symptoms do vary. I have with me here a registered dietitian, Miss Emelia Banfo, who will take us through the valuable insights on how to cater for ourselves to not to contact the PCOS and then the punitive measures we can put across. All right, so welcome to the Cindy Show.
Hello.
It's great to have you here.
Thank you for inviting me. I'm happy to be here.
All right, so tell us, what is PCOS?
So PCOS is the abbreviated form of polycystic ovarian syndrome or ovary syndrome. So it's a metabolic and hormonal condition that happens to women of reproductive ages, as you said earlier. And with PCOS, it's when, as I say, syndrome, meaning it doesn't have only one sign that shows that this is happening to you. So it's a collection of different signs and symptoms that show that an individual or a female is going through this hormonal change or metabolic change.
So what impact does that have on your body?
Well, for a female, it has a lot of impact. It has a mental impact. It has physical impact. So I'll start with mental impact. So some of the signs and symptoms of PCOS is hair growing in areas that usually shouldn't grow for a female, like the chin area, on the chest, on the lower abdomen, and the back. Yeah, so most people that have a lot of hair in that area usually go through stigmatization. People are bullying them, laughing at them, especially when they are younger. And then for mental, there are women that have or go through infertility because of PCOS. And because of that, they are not able to face, let's say, family members, friends, and then they now go into depression. PCOS also causes insomnia, and some people can't sleep. So before you realize they are stressed, and then it's a cycle, continuous stress, thinking, depression, all that, all over again.
I have one or two hair here, and then I battle insomnia.
It doesn't mean that you have PCOS.
Okay.
So to be diagnosed of PCOS, you have to see your doctor. Your doctor has to run some tests for you, and then they'll look at the signs and symptoms that you have to know if you actually do have PCOS.
So how common is PCOS?
So WHO states that PCOS is popular when you take 10 women. Out of those 10 women, one of them would have PCOS. And then they've also stated that with women who have PCOS, about 70% of them have not been diagnosed. So it means that they have the condition and they themselves don't even know.
So they don't know how the WHO got to know that 70% of them.
So I think they'll take the women of reproductive age, then, go back on some of the signs and symptoms that they have. Yes, and then they'll do an estimation to know how these women can probably have the PCOS.
So if you say a hormonal condition, can you explain it into details? Someone might not understand what a hormonal condition is.
Okay, so PCOS is both a metabolic and then a hormonal condition. So I'll start with hormonal as you want me to explain. So there are hormones that help every individual to function properly. Yeah. So hormones are chemical signals that the body sends to various parts to function in certain ways. So for PCOS, there are certain hormones that are not in their right levels. So it's either high or low. And so the dysfunction or the irregularities with the levels is what causes some of the things like the hair growing on the chin to occur. Because for every woman, there are hormones like estrogen, progesterone, that have to go to the brain and other parts of the body to help the body to function. So as I said earlier, if they are low or high, then it means they are causing a problem for the
Is
woman.
That the hormonal imbalance?
Yes, that's hormonal imbalance. And then for metabolic, metabolic means how the body functions. So how the body takes the major food groups, that's the carbohydrates, fat, protein, how they take them and distribute them for functioning in the body. So for PCOS like this, there's something we call insulin resistance. So the body cannot process carbohydrates properly for the body to use. So most of the times you realize that their blood sugars are high. They can't.
Those are the PCOS.
Yes, so their blood sugars are high. That's what we call insulin resistance. The body can't process insulin properly. Yes.
So can I say that if someone who has diabetes, the person is likely to have PCOS?
Well, actually, someone with PCOS is likely to have
diabetes.
Yeah, so somebody with diabetes. So with PCOS, I'll come back to diabetes. So with PCOS, some people have it through genetics. So maybe their mother had it, now they have it. So most of the times in that family group, they would have maybe diabetes, hypertension, high cholesterol, all those things. And the PCOS comes in to review that, okay, this is what is happening in the person's body. So you would ask a question that in a family like that, will a man also get PCOS? No. So men do not have ovaries, so they will not get PCOS. But they are at risk of research, so that they are at risk of some of these metabolic conditions like diabetes, hypertension, and then the rest.
So if you have, at what stage does it happen?
Okay, so for every individual, there's not a specific stage that it happens, but immediately you hit menarche, that's like your first period or reproductive age, you're at risk of
contracting it.
Yeah.
So you mentioned that hormonal you mentioned hormonal something.
Hormonal imbalance.
No, you said it's two causes. We have the metabolic and then we have the
hormonal and metabolic. Yes, but then PCOS is not caused by only that. I stated that the genetic causes, lifestyle too.
Exactly. I wanted to ask about the lifestyle. I wanted to ask if it is a mixture of lifestyle and then the metabolic and then the hormonal.
Okay, so as I said, metabolic and hormonal are happening inside the body. So now outside the body is lifestyle, the life you are living, whether you are exercising well, what types of foods are you eating, what kind of, are you drinking, smoking? Those are our lifestyles. So those things will come and impact what is already happening inside of you. Yes.
So drinking, smoking, what effect does it have on PCOS?
Okay. So aside from drinking, smoking, let me start with the food. So people with PCOS or are likely to have PCOS as to avoid or not consume junk foods. Ultra processed. When I say ultra processed foods, like foods that have been processed too much, they don't have any proper original states. Like the fizzy drinks like this are processed, ultra processed foods. And then they have their own impact. When they come into the body, they'll trigger hormonal imbalances, metabolic imbalances that would cause the PCOS to show itself, or if the symptoms of PCOS to become worse. So it's with the lifestyle, how lifestyle can impact the PCOS.
So right now, as I said, how will I get to know that I have PCOS? What symptoms will I see?
Okay, so usually people with PCOS have no ovulation, anovulation.
No, at all.
So yeah, that's what we call anovulation. So no ovulation. Sometimes they have no periods coming. Others too have periods coming, but they are for longer periods, like longer days, and then very heavy flow. These are not the only things that can indicate that you have PCOS. So that's why I mentioned earlier that you have to go to the doctor to have labs run. So they will take the labs and then the symptoms that you come with to let them know that, okay, you are having PCOS. Yes.
You mentioned of anovulation and then longer periods of menstruation. So aside that, how will I get to know that I have PCOS?
Okay, the other signs that we've said earlier are hairs growing on the chin, on the chest. Some people to get balding spots or bald spots, so hair thinning, hair falling out. Yes, some people have weight gain, unexplained weight gain, and then it's very difficult to lose that kind of weight. Some too have the insomnia that we spoke about. Yeah, these are some of the symptoms that people with PCOS would usually report with.
So if I have the symptoms, all I need to do is to go to the hospital for diagnosis.
Yes.
So is that a long process? Is it an expensive process?
Well, long process. It takes you can get your labs the following day. Others, depending on the hospital and how they are running, yeah. But then for expensive, yes, some of the labs are a bit expensive. And then depending on where, the labs have different prices. So depending on where you are doing the lab, yeah.
You talked about the menstrual cycle. So if it has an influence on menstrual cycle, there is a higher possibility of it having an influence on fertility.
Yeah.
So what influence does it have on fertility?
So as I said, there's no ovulation, meaning the eggs are not being released. So even if there should be a pregnancy, it won't be able to happen because there are no eggs to fertilize. Yeah. So since there are no release of eggs, there's no going to be any fertility that causes the infertility.
Okay. All right, so let's go for a quick break. We'll be right back.
So we can all agree that this is such a sensitive issue and it needs to be amplified because there are so many women out there silently suffering with PCOS. And I believe they need to see this video. And that is where you come in. I mean, the best way to help us push this message out there to reach the right people is by liking, commenting, and of course, sharing the video. So I would ask of you to please like, comment, and share this video with somebody that might need it. And if you're not subscribed, kindly do subscribe because as much as it helps us keep the conversation alive, it also encourages and motivates us to keep bringing you high quality guests and also keep producing high quality videos like this. Thank you.
Welcome back, viewers. I hope you are enjoying our show. All right, so I want you to tell us how genetics affect PCOS.
Okay, so genetics affects PCOS. I would explain it in simple terms. So for women in their reproductive years that are having difficulty in conceiving, they would usually realize a trend in their family tree, coupled with the other signs that we've mentioned, the hair growth in different areas, thinning of hair, insomnia, all those things. They would realize that in their family line, there was difficulty in conceiving. Maybe the women having been diagnosed with PCOS, but from the signs and things that they are seeing, it's genetics, right? And then I would also explain genetics in the side of a male. Even though men do not have ovaries and are not directly impacted by PCOS, the metabolic diseases that affect women with PCOS, as long as you are in a family and you are linked by genes, you are predisposed to, as a male, is predisposed to some of these disease conditions like diabetes, hypertension, heart diseases, and so on. And then these men will eventually transfer some of these genes to their children. So they would have children who are females that have PCOS. So that's how the genes work.
In a situation where a lady or a woman with PCOS is able to conceive, how does that affect the pregnancy?
Okay, so yes, true. Women with PCOS, even though they battle infertility, with the treatment and management, a lot of them have been able to conceive. Usually, for those who are able to conceive during pregnancy, some battle gestational diabetes, preeclampsia. So preeclampsia is hypertension during pregnancy. Some also end up having preterm babies. And then also some battle endometrial cancer. So even though they've been able to conceive, there are some complications that come with the pregnancy. But with regular checkups at the hospital and care, these things will be able to be managed and there will be no problem.
So for a woman who is pregnant, what are some of the safe and effective treatment patterns?
Okay, so I'll start with lifestyle. So you have to go and see your doctor.
Everything begins with you.
Yeah, you have to go and see the doctor. Then you have to be referred to the appropriate healthcare professional. So if it's gynecology, if it's dietitian, because all of them have different jobs that they will do holistically to help you and then the baby.
So for someone like me, let's assume I don't have it. I'm hoping I don't have it. What do I need to do so that I don't contract it?
Okay, when you say contract, it's not like an STD that you can get.
It's okay.
Okay. So you want to look at your family tree.
Okay.
You want to get tested. You want to
No, I asked that because of the lifestyle habits.
Okay.
You get it?
Okay.
Because you mentioned about smoking, you mentioned about drinking. So there's a possibility that if I'm used to smoking or drinking, I can get that.
Okay.
That is why I asked that.
So with your question, regular checks. So for you to know that you have something, you have to do what? You have to check.
Yeah.
So you go to your doctor, you can tell them that you probably don't have any signs, or maybe you just mentioned the 2 or 3 signs that you have that you think is PCOS. They will run tests for you, and then they will tell you that, oh, maybe you do have, maybe you don't, or maybe you're at risk of having. So the best thing to do is to run the labs and then know what is happening with your body, because you can't look at only the outward and then come to a conclusion.
Are there some foods that you need to stop taking? You're a dietitian.
Well, with food, I said earlier that junk foods, ultra-processed foods, when I say ultra-processed foods,
you mentioned the fizzy drinks.
Yeah, fizzy drinks, all those things, foods that are fried too much, foods that have been baked with a lot of fat, all those things have to be reduced. Right now, we are saying reduce. What can we do? So it's best to add high-fibre foods. When I say high-fibre foods, we have a lot of high-fibre foods in Ghana. We have our vegetables, contemporary garden eggs, all those things are high-fibre.
Eating right in Ghana is very expensive.
Well, getting sick in Ghana is very expensive.
But I think eating right, like the good foods, it's very expensive.
Getting sick is very expensive, so you have to choose which expensive you would want.
Okay.
But we shouldn't overcomplicate eating well. So when we say whole foods, high-fibre foods, we have couscous, we have fiber.
We have couscous.
Yes.
What is couscous? Because I know couscous to be a northern Nigerian food.
So that's what they add to the Burkina, the whites, and then they add millets.
Yes.
So the millets that they are adding has enough fiber to work with the couscous, the milk, all that. We have sorghum.
You mentioned milk. Milk has fat, high fat.
Yes.
So we should stay away from fat.
So if you are being diagnosed with PCOS, there are, when you go and see your dietitian, there are foods the individual, the individual that is recommended for you. Yeah. So this one I'm talking, I was saying this in connection with what you asked earlier, how to not, put yourself at a risk of having it. So treatment for somebody who is already having PCOS is different from someone who is trying to not trigger PCOS.
So the PCOS, is it something that can be cured totally? Even if it's from genetics, can it be cured totally?
No, PCOS cannot be cured, but the symptoms that come with PCOS, like the weight, insomnia, all those things, all the other symptoms can be managed and then reversed. So reversal, meaning if you slack or you go back to your old lifestyle, you will come back to where you were. So you start having all the symptoms again, and then you have to start from scratch. So that's how PCOS is.
So I have it here that changes in diet can help you with that. Exercise too. How true is it?
That's true. So we've established that junk foods and all those things put you at more risk, and then they multiply the effect of the symptoms that you have. It's the same way eating right reverses, as I said, the reverses how you'd have your symptoms, how do you feel. So diet, exercise play a huge role in PCOS.
So for the PCOS, what are the long-term effects of it if it is left untreated?
Long-term effects. So as I said, so I explained something in a vicious cycle. So it means your stress is going to go up. You are stressed about all your symptoms. If you are wanting a baby, you can't have it. You are stressed because your hair is falling out. You are stressed because you have hair in places that you don't want them to, because you want glass skin, but then the hair, there's no allowing that to happen. All these things would increase your stress level. And then when your stress level goes up, it will multiply how the symptoms of the PCOS, portray themselves. So it means you are in a continuous virtual cycle, right? So it means that every time you're stressed, all the symptoms will increase, all that is going to not stop. It doesn't end.
But then you can cure it, but you cannot cure it wholly.
You can manage it.
You cannot take out the root of it.
Yeah, you can manage.
You cannot take out the root of it.
When you say root, well, as I said, PCOS is different signs and symptoms. So we are trying to, reverse the symptoms. Then if you have polycystic ovaries.
What is that polycystic?
Okay, so polycystic is, how do I explain? Okay, polycystic is when the ovaries, right, are inflamed, and then it forms a sac, and then there are fluids inside that sac. So if you take a normal ovary and then one that is inflamed or is polycystic, you realize that polycystic means many. Yeah, so small. They look like balls with, or let me say swellings with liquid in them. After a certain, if you just have polycystic ovaries, or what we call cysts, those are called the cysts. If you have ovarian cysts, those things, they can be reversed. It doesn't mean that you have PCOS.
I'm confused.
Okay, so let me take it again. So I'll explain the difference between ovarian cyst and PCOS. So cyst is when fluids inflame, or fluids are in a sac in the ovaries. So it means your normal ovaries have sacs of fluids in them, right? That's ovarian cyst. But with polycystic ovaries, it means that the same thing is happening, but there are a lot.
Okay.
Right? With ovarian cyst, it can easily be reversed. It doesn't mean that you're having all the signs and symptoms of PCOS and all that. No.
So the problem lies when it becomes many.
Yes, many, with the symptoms that we've spoken about.
Okay. I think I've understood you now, and our viewers have been educated. So let's go for a quick break. When we come back, we will talk about the PCOS Foundation and how far you are going with it. We'll be right back.
So we can all agree that this is such a sensitive issue and it needs to be amplified, because there are so many women out there silently suffering with PCOS. And I believe they need to see this video. And that is where you come in. I mean, the best way to help us push this message out there to reach the right people is by liking, commenting, and of course, sharing the video. So I would ask of you to please like, comment, and share this video with somebody that might need it. And if you're not subscribed, kindly do subscribe, because as much as it helps us keep the conversation alive, it also encourages and motivates us to keep bringing you high quality guests and also keep producing high quality videos like this. Thank you.
Welcome back, viewers. I hope you've enjoyed our conversation with Miss Emelia Banfo.
Yeah, correct.
So let's talk about PCOS Foundation. What do you do?
Okay. So as the name implies, PCOS Foundation. So it's a foundation that was launched this September. Yes.
To help, 2025.
Yeah. To help women and girls in Ghana living with PCOS. So our main focus is to provide education, a community, a sisterhood, for women that have PCOS. Our aim is also to help spread knowledge and information about the condition. With time, we'll do outreaches, and then go to schools to, because that's where most of these people have the condition, they don't know.
To even begin with adolescence.
Yes, in their younger ages, so that we can help bring more awareness to the condition and how people are struggling with it. So that's our main focus, to bring support, education, advocacy, awareness for women living with PCOS in Ghana.
Is there an NGO?
Yes, so it's a foundation. So we are accepting, anyone who wants to support in any kind of way. If you want to volunteer, you can reach us on our social media handles. Right now, we are active on Instagram and TikTok. And then we'll put out our numbers, our email address that we can be reached through.
Some people begin to advocate on something that they've been through or something that they've seen someone, a family or a friend go through. Is it that it is something that you've been through or someone close to you have been through it? That is why you want to create an awareness on that, or you want to be an advocate of that?
Okay. So our foundation has, our members in the foundation have people with PCOS, living with PCOS. And some of the people in the team are dietitians. So we've seen clients come in with PCOS. We've seen how it has affected their lives. And we want to do something to help women living with the condition.
So is it that those in their foundation are all dietitians?
No.
So can I join?
Yes, you can join the foundation. So the foundation is made up of doctors, nurses, psychologists, people who are into sports and fitness, fitness coaches, dietitians, different working fields. Because if we center it only around dietitians, our reach will be very small. We want to reach out to different people, because for PCOS, there's supposed to be a holistic care, not only lifestyle. I told you about how people get depressed, insomnia, all those things. I'll see different people for whatever they're going through.
You spoke about the mission of PCOS. What about your vision?
So we are looking to spread the word or awareness of PCOS in Ghana. There are other foundations in other parts of Africa, but we are looking forward to spread the knowledge and then help women with the condition. With time, we'll be able to, as I said earlier, that some of the labs are very expensive. But with time, we'll be able to help women even just do the labs, so at least they'll have a sense of awareness of what is going on with them.
Do you think women will lack the knowledge of PCOS? Do you think so? I've never heard of PCOS.
I believe so. I believe so. It's not for only women. I think for both women and men, because those
women are at risk of it. So let's.
Okay, so those who have it, most of them are struggling in silence.
They are struggling in silence
because most of the times some people can't relate to what they are saying, or will not really fully understand if they even explain what they are going through. You can only sympathize with them and say, "Oh, sorry, it will get better," but you don't really understand them from where they are coming from. So some of them don't really like to talk about it. As I said, some people too are bullied, like those with the hair and things, those who are big. Some people are bullied. And I also want to say that not everyone with PCOS is big. There are women who have PCOS that are thin. There are people who have PCOS that are thin. So people go through different, struggles with PCOS, and then we want to lend a helping hand to those people.
All right. So I think, is there anything you want to talk about the foundation, your location, everything?
Okay. So we are new, and then we are soon would be reaching out to different individuals, like for volunteers to come and help us from different regions all around Ghana, so that we would have a wider range, a wider reach to help more people come. If we only center ourselves in Accra, there are people in Wa, there are people in Takrade that will not be able to, participate in the things I want to do. So would be calling for volunteers soon. So everyone should stay tuned.
So currently your location is in Accra?
Yeah, currently we're in Accra, but then we are working on having reps in different parts of the nation. So
as a dietitian, what do you have to tell women about PCOS?
I'll say listen to yourself. You know your body more than anybody else. And if something doesn't seem right to you, don't wait for a long time. Don't wait for months before you go and see what is actually happening. Immediately you realize that something is off, you have to go and see your doctor to know if there's anything wrong with you.
So,
yeah, that's all.
All right, thank you for coming.
Okay, thank you.
I've learned so much, and I hope my viewers too have learned so much. When the time is yet open for volunteers and all that, I would come and volunteer.
No
I would
problem.
want to. Maybe there are some people that I know who even have the PCOS, but they don't even know.
Yeah.
So maybe when we all join hands together, we can make an impact.
Yes.
We've come to the end of our discussion with Miss Emelia Banfo. I hope you've been educated. We've learned about what PCOS means, the effect, and then how we can prevent PCOS. Please don't forget to subscribe to our YouTube channel, The Cindy Show GH, and all our social media platforms, Facebook, Instagram, Twitter. Subscribe, like, comment, and share. Until next time, it's bye-bye.